Good afternoon, everybody. We're really excited you could be here. You picked the right session. This is how to make $1 million in a month, right? That's, yeah, I wish. Okay. Anyway, we're really glad that you came today. We have a phenomenal program, and I'm going to kind of rush through the introductions because I want there to be more time for you to hear the speakers and also for the activity that we have planned. We've put some papers on your chairs. That's reference material. So if you're sitting on it on your chair and it feels a little crunchy, there's paper underneath you. And we are going to be doing an activity later, so if you're sitting by yourself, which doesn't look like anybody is, we might ask you to move to join another table. Okay, so let's get started. My name is Eiseman. I work at Chemonics International, and I'm the co-chair for the International Health and Nutrition Workgroup, along with Elvira Beracochea, who's one of our panelists today. And we want to welcome you to Ensuring Healthy Lives. I don't know how many of you were here this morning and heard the introduction about the work groups. So not everybody. So there are 22 work groups at SID, ranging from geographic topics to there's gender, so cross-cutting topics, there's the health and nutrition one, and we really encourage you to participate. It's a great way to learn, to meet people in the development community, and also to contribute. So you can go onto the SID website and find out more information. This panel is going to be looking specifically through a health lens at the post-MDGs, looking at the Sustainable Development Goals. And we've got a few activities planned to help you think about what does that mean, what's the impact, what's going to happen, and that's what the panel is going to be addressing today. And I'd like to introduce to you our moderator, who we are so excited to have Scott Jackson as our moderator. He's currently the president and CEO of Global Impact, which is also the secretariat for the Global Health Council. And Scott has extensive experience in the international development arena. He's worked for groups such as PATH, World Vision, a few others. And I was looking for a quote for something to say about Scott that people might not know. And they said, his passion for support of humanitarian relief and development progress for the world's most vulnerable people make him the right person to be moderating this session. And we called a couple of people to say, who can we get to moderate? Who's the person who could really make this an exciting panel? And I spoke to several people, and they all said, Scott Jackson, Scott Jackson. And so we thought, Scott Jackson, he's the guy. So we were really lucky to get him. So Scott is going to be introducing the panel members, and he'll be leading this session and explain some of the activities we have, and then we'll summarize at the end. So thanks again for coming, and we're looking forward to an exciting session.
Thank you very much, Ellen, and thank all of you for being here. And actually, part of my passion, why I feel privileged to be a moderator today, is my passion from each of you and the work you do. Because without that work, so many mothers and children would not have what they need. And that's, of course, why we're here today. So I'm going to keep my remarks short, but I want to really maximize our time for our distinguished panel and also for all of you. We're going to put you to work today. But before we do all that, of course, just a couple more context setting. We're all here because the MDGs, 4, 5, and 6, are being kind of replaced, which will be part of our discussion, with SDG 4, Ensuring Healthy Lives. And so, you know, what all of us have rallied around and done tremendous work on, whether it's been reducing child morbidity or increasing maternal health, or eliminating HIV, TB, and malaria, the paradigms are changing. You know, will the focus remain? Will we continue the work that we've only started or certainly not completed? How will we find scale? How will we measure impact? How will we have even greater local engagement? All of these are going to be factors as the SDGs continue to evolve and really take shape. And so our panelists today are going to give us some very unique perspectives. It's a great combination of panelists and subject matter experts today. And I'm going to ask them some key questions. But before I do that, let me introduce you to them. Dr. Elvira Beracochea. And Elvira is also co-chair with Ellen of the working group. So it's important for you to know that both of them will be available to continue the work of SID in this area. And Elvira is also the president and CEO of MIDEGO, which was named after the MDGs. But probably equally importantly is she really is a global expert on the MDGs and on their next iteration, and has written about it extensively, has several books, and so it's going to be terrific for us for kind of setting really the kind of deeper context in a moment. Clive Mutunga. Clive serves as a family planning and environmental technical advisor for policy evaluation and communication, and that's for the Population and Reproductive Health Office for USAID. And as Ellen has suggested several times, we really wanted the right person to talk from USAID, and Clive brings a really important perspective because he's able to look at the impact between population, policy, and the environment. And a lot of the SDGs really take on some of those dimensions, which we'll learn more about. And finally, it's really a pleasure to introduce Diana Silimperi. And Diana is a medical doctor, epidemiologist, and very, very well renowned for her work in not only delivery systems, but in health systems. And again, that's going to be a critical element to this SDG, as probably some of you have been reading about. So with that, I'm going to ask our panelists a question or two, and then we're going to actually ask the tables, all of you, to address some of those same questions and a few more. And then we're going to come back and have a bit of a report out, as time will bear. And we felt like it was important to gather your input because indeed, and I think Elvira will talk about this, this is the time for stakeholder input. So whether it is Society for International Development or the Global Health Council or other means for stakeholder engagement, this is really our time. Much of that work has already started, but it continues, and so we want to make sure we capture as much of that input today and make sure it gets to the key portals for stakeholder engagement, including SID and the Global Health Council. So, Elvira, let's start with you, if you don't mind.
I don't.
Great. And I'd like to actually ask you two questions.
Okay.
So I've already got kind of the pick of the draw, if you will, on 2 versus 1. But the two questions are, first of all, how does the paradigm need to change to ensure sustainable results and that this SDG 4 can actually be achieved? And the related question is, how will that increase our chances of making good health investments and ensuring healthy lives?
Mm-hmm. Yeah, very good questions. Thank you, Scott. And thank you, everybody, for coming today. We're very, very happy to have you here. And thank you, Emmett. Join us. I'm a physician, and I've been working in global health for more than 25 years. And I was very, very engaged when all the preparation meetings towards the MDGs and when the first Millennium Project reports came out and the quick wins and how we can really make a big impact. After having been a doctor for 20 years, I realized that we have the knowledge to really take care of most of the mortality that we see in developing countries. And as I was born in South America, and I felt that it was so important to make sure that we really transformed global health, that we really delivered what we knew had to be done. And so when I read the Millennium Declaration, by the way, I suggest that everybody read the Millennium Declaration because it's more than just the MDGs. It's just 9 pages. You just Google Millennium Declaration and you'll see that there's a lot more than the 8 MDGs. It's basically a roadmap of really how global health, how international development should work, because we talk about principles and values, really what it is to be an international health professional, what it means to impact the health system of a country and the health professionals of that country. And it talks not only about development and global health and mortality, but it also talks about peace and security and disarmament and many of the things that really inspired us to work in development. And I think it's very important that we always connect to our mission, and as professionals in any field of global health, I believe that we all want 30, 40, maybe 50 years from now to look back and see that we really made a difference. And I don't want to look back and 30 years from now and still see children dying of diarrhea, malaria, tuberculosis, women dying in childbirth. I think in this century it's just criminal that we see women dying in childbirth just because where they are born and where they live. So that's what really inspires, and that's what I really want to ask everybody to really keep the Millennium Declaration and to keep it alive and to read it and to look how you can apply it in your work. This is really something that I've given so many copies and ask people to read, because this is really the basic platform for you to get engaged in the Sustainable Development Goals. The interesting thing is that the SDGs are being developed in a more participatory way, so we can really get engaged. You can have a say, and we really need you to have a say in really not only what SDG 4 is all about, but even how it is worded. Because if you look at the SDG 4, and you have it on your chairs here, you see, for instance, end preventable infant and under 5 deaths. I would like to see ensure that every child gets immunized, ensure that every mother has access to antenatal care visits. We know that every woman needs at least 3 visits. We know that they need to have a supervised delivery. We know that children need to be immunized, they need to be breastfed, that they need to have their growth and monitoring visits. We know those things. So let's make that a standard for that to happen. And that's why I believe that we have to get engaged in the SDG 4, how it is worded. So one of the lessons that I want to prevent from happening is that when the MDGs got started, I think I was very excited about the MDGs, but it was 2004, 2005, and nobody was talking about the MDGs. We cannot waste 5, 10, and maybe even 10 years. Now everybody's talking about accelerating the MDGs, but we should have done that 10 years ago. So create that sense of urgency in our work is very important, and that we get that energy from that inspiration that we have in our mission in our career. So how do we change the paradigm? Well, I think we all have to get engaged, and we all have to participate and contribute and be very accountable for our successes and our errors. I think we have to be more accountable about what didn't work and try to reduce that, unless we really count. I believe that we have to adopt 6 Sigma. 6 Sigma means 6 deviations of standard deviations, which means that we should allow only 3.4 million errors per 1 million opportunities. So we should miss immunizing a child only 3.4 per 1 million opportunities. We should miss providing a supervised delivery only, or probably less than 3.4 per 1 million deliveries. So if we held that standard, and that's what I like about private sector, we held that standard, the same standard of the airline industry, then we would be making a much better impact. But we have to measure those errors, and we have to be accountable for them. And I think my time is up, but I'll be happy to keep talking about these things.
Yes.
Thank you.
And Diana, I'm going to turn to you. How should the traditional donor-recipient paradigm adapt so that actors are held mutually accountable, both sides, in achieving the global and the national health goals?
I think as a preface, it's important to realize that these high-level agreements that are made and the various accords from Paris and so forth are absolutely critical, but they're very high. They're at a high altitude. And part of the challenge for all of us going forward with SDG is to translate from that high altitude down, not just national, but go to subnational and community level. So that's kind of a context that I'd like to put out there. And then let's talk about donors first, and then the recipient side, the recipients being both governments and implementing partners. So on the donor side, I think as we go forward, there's clearly got to be program and project design that is focused on countries, not donor needs, but country needs, and is aligned with national or recipient government policies, priorities, and national plans. But more than that, those recipients have to be at the table in the design, because it's not simply aligning, looking at the plan, it's actually understanding it. So you need the recipient governments at the table, translating it, understanding what will really make a difference. At the same time, donors will have a responsibility to assure that those plans that they're now aligning with are evidence-based. Plans and policies are evidence-based, so the proof is there to have the impact that we want, ultimately, according to the SDGs. Secondly, we use the word harmonize. Harmonizing across donors means trust. There has to be more trust and transparency between donors. At the same time, those donors are going to have to collaborate in the design of these projects across each other. We have to agree with recipients, particularly governments, that we're going to use the same performance indicators, that we have to measure them the same way, numerators, denominators, and we have to try to use the same methodology across the various donors and aligned with those that the government has put forward and ideally are already in their national plans. So the UN has talked about a country accountability framework, particularly I think the Global Strategy for Women and Child Health. That kind of common framework that's used across countries, but even in a country is used across donors and with the government will be absolutely critical for financing and the results. Donors are going to have to facilitate transparent reporting of performance by the recipients.
Sure.
Performance results at and to their fellow colleagues in government outside of ministries of health. But I would propose also a very important step forward is to capitalize on the role of citizens in this development relationship. And so the feedback, the expectations and the feedback on performance have to be translated down to the civil level, down to the communities, if you will. Poor performance, poor recipient performance, regardless of who the performance is, has to have consequences as we go forward. Now we have to be careful that those consequences are not going to penalize the beneficiaries ultimately of the aid. So that's kind of a whole discussion unto itself, but the important thing is that there has to be consequences that, in fact, the donors hold recipients responsible for. They can help with that. They can develop more aggressive, more systematic risk assessment frameworks to assure recipient readiness, whether it be financially or management-wise as they go forward. So there's a whole range of other things, but that's at least a starting framework for what donors need to do differently in this paradigm. Let's look at the recipients for the moment. So government has to ensure then, if we're going to use government plans, they have to be evidence-based, as I noted before. So government recipients have that responsibility. They have to be proactive and stand strong across different donors. So there's consistent standards, and it's not like, here's my favorite donor, you get to do it differently, but across the board, there's consistency in terms of aligning with those priorities. They have to assure regular, transparent reporting of results, again, at levels from national down to community level. I would propose they need to also reach out beyond public sector and include the private sector, making sure that when they're talking with donors and influencing programming, that they're looking at all the resources that are available in their country. And lastly, they really have to focus on using the money that they, in fact, will receive, hopefully, through this better collaboration to strengthen their own systems, their financial management, their recording, their risk and fraud mitigation systems, and of course, I'm going to end up with their strong management information systems. So I talked about indicators. Ideally, those indicators to measure SDGs are aligned with what the government's already measuring, so it's built in to plans. Ideally, in my dream world, we'd also see movement towards using HMIS systems for that measurement rather than separate vertical systems that are normally put in place, so that in fact, again, we'll strengthen the HMIS systems in countries for longer-term sustainability. But last, let's look at us. Let's look at implementing, or many of us, and not all in the room, that are the implementing partners. There are probably going to be real things that we need to look about in terms of our competencies, our skill base, as we shift from management of programs and technical assistance to much more, and many of us all have, much more focused on capacity building, organizational development, mentoring, and probably a niche level, high level TA, which means that it may be harder for those entering the field to really get their opportunities, because I think it's going to be much more focused. We may need to look at new organizational models, costing structures, business models, but most importantly, we also need to look at where, in fact, we may have a very special role to play and different, perhaps, with governments and donors. One of those may be around fragile states, where, in fact, the government and recipients are not going to be in the usual state. And as we all know, when we look at where the deaths are occurring and where the MDGs, much less SDGs, are falling behind, it's like 12 out of the 13 so-called fragile states that are, at least according to one definition of fragile states. So that's a really special need and a niche we need to look at. We need to reach the lowest quintile. If you looked at the MDGs, you all know that there's a wide range of success, and in fact, that lowest quintile is not being reached. So the needless deaths are occurring disproportionately in the poor. What are we going to do to reach those? We need to really look at honestly scaling up and document what works, the evidence-based implementation research that goes along with that to inform other recipients and government recipients and the donors. And lastly, but not leastly, we really need to look at the costing of the effective, proven packages of care in the delivery system that we know will make a difference if they effectively reach down to each and every community. So there's a lot more that we can do. We have a lot of successes, but I think we can. Donors, recipients, governments, implementing partners, both kinds, really can make a difference as we go forward in this new paradigm.
Thank you, Diana. There's the next perspective. Clive, can you help us get a sense of how do we place more responsibility but also ownership on the recipient countries? It seems like a lot that we're asking, you know, not just with the MDGs, but now the SDGs. And, you know, give us some sense of how the environment and the population impact that. More people, less resources. What's your perspective on this, particularly the ownership part?
Thank you, Scott. I think I'll begin by just saying that the issue of ownership has been at the forefront of policy discussions on aid and development for the last few years. And just to mention to those who are probably not familiar to what the Paris Declaration defines as ownership, is the goal for partner countries to exercise effective leadership over their development policies and strategies and to coordinate development actions. But also their clear agenda for action went further and says that countries have more say over their development processes through wider participation in development policy formulation, stronger leadership and aid coordination, and more use of country systems for aid delivery. But whereas the Paris Declaration envisaged ownership in terms of national government-led development strategies, their clear agenda for action acknowledged a very important role for the civil society as development actors with a legitimate role to play in our development process, not only in the delivery of services, but also in formulating policies and strengthening local capacities and ownership. But whereas the discussions on ownership take place in the capitals all over the world, one question we should ponder to ask ourselves is, what do those on the receiving end in the international assistance efforts, people who are in poor communities all over the world, what do they think of ownership, and exactly what does that mean to them? But one thing is clear, that great ownership can be achieved by engaging the community. Community is the key, and communities get it. I recently returned from a trip in the Lake Victoria Basin in Uganda, and you speak to women in a remote island in the Lake Victoria Basin, you talk to them and they get it, they get the links. They talk about population, they talk about their reproductive health decisions, access to health care, to education, as it relates to environment, for environmental sustainability and for entire sustainable development goals. So I think a new paradigm of ownership should really put the community at the center and really see how sharing control, information, and responsibility through like effective planning, appropriate timeframes, and forming and maintaining effective relationships. So one of the things that has been mentioned by my colleagues is really the issue of sharing control, information, and responsibility, which is a key component of our ownership. So to the extent of engagement and influence of local people in decision-making process is an important indicator for the level of ownership they feel over development efforts, broadly and also specifically to the health goals. When donors and aid agencies make all the decisions, then people don't share a sense of responsibility and will most likely be unable and willing to extend the life of development initiatives once an aid organization leaves or funding ends. So one key component, again, is really working in partnership with local and national government institutions. Most of the time, donors emphasize ownership by saying that they will cede control over development efforts to national government structures and support national strategies. We know these good development strategies made by different countries. We know the different health sector plans that are supposed to be implemented by ministries of health. So assuming that seeding that equals local ownership might not be really the way to go, but because in most of the countries that we work with, you find that there are different levels of government. The national government, which is really the custodian of the national level policies and strategies, and the local governments, which are really kind of trying to implement the specific policies and programs. So strengthening local capacity, again, I won't belabor on the need for that. And then also the need to plan for a future without aid, going with the notion that maybe after a couple of years, the aid will not be available. So thinking of how, because there's always a fine line between aid dependency and effective aid assistance. So really having that in mind. And then kind of just supporting local ownership really means requires a willingness to listen and respond to feedback, as well as a commitment to share information, power, and control. And it should be both ways. It should not be just coming from one side of the coin. So aid providers should approach their relationships and aid efforts in ways that genuinely allow local people, aid recipients, local NGOs, and governments to define the terms for local and national development processes and to take ownership of the results. Thank you.
Thank you. And I want to thank all three of our panelists. I think what you've heard is a very interesting continuum of how we might actually look at operationalizing the SDG. And we've heard, first of all, that there has to be a sense of urgency from the beginning, not after 2 or 3 years. And we've heard that there has to be some sense of measurement and failure bandwidth, if you will. We've also heard that if we're really going to look at both the donor and the recipient, that there's a really bottom line trust that has to be built at all levels with accountability. And then the whole notion that ownership is not at the national level, it's actually at the community level, that you have to align and thread the needle, if you will, all the way from the recipients to the community, to the country, to the implementers, to the donors. That means a change in behavior, and I think a change in skill sets, as our panelists have suggested, not just in country, but also in this room. So with this continuum, we need your help. We need more input, whether it's on this continuum or other contexts of this SDG. Is this really going to bring us where we want to go in the next few years? And what we'd like for you to do is we'd like for you to tackle the question on your table, or, if you have a mutiny, you can choose a different question, okay? Or join a different table. But we have a variety. We have actually a total of 7 questions. So we've taken the first 4 to 5, and we've then added a couple. And we've also given a few tables that are kind of wild card tables, if I remember right, Ellen. Is that right? So let's just, if a couple people could tell me what question they have, so you got to get your bearings, okay? How about this back table? What's your question?
How does the traditional donor-recipient paradigm adapt so that actors are held mutually accountable to local and national governments?
Excellent. So you got a head start on this one? Yeah. You can do this one? Okay. How about this middle table?
How does the paradigm need to change to ensure sustainable results in the SID-4?
Easy one, right? Okay. All right. And how about right here? This front table. You've got 2 questions. What's that? Okay, good.
What are we missing or not? Great leadership.
Excellent. Okay, so you're going to tackle that a little bit, huh?
Good.
All right, okay. All right, so I think we've got a feel for what people are going to be going after. We're going to give you not a lot of time. It's a late afternoon. It's the last panel of the day. We're going to get you out of here on time. So, but we do want you to take the next 15 minutes and really engage with each other and not only have some fun with this, but think about how you would literally answer these questions. Then we're going to come back and ask a few of you to report out, and we're going to then have Diana do a bit of a summary. Okay? So next 15 minutes, Ellen, any other instructions?
I'll give you a 5-minute warning, and then when time is up, I'll move away from my table and ring the bell. Also, if you wouldn't mind, there are some white cards on the table as well. If there are specific notes you want to make sure that go into the notes that Larry here is from the position board, and he's taking notes. And if you want to make sure that some of the things you have to say potentially get put into the notes of this session, please write them on the white card and leave them with Scott.
And I think if it's all right, I'll ask our panelists if they're willing to be rovers.
Yeah, sure.
And be available if they can be helpful, okay? But you can't cheat. You can't just take their notes from them. Good job. It really was an interesting continuum. The
Good,
three
I
of you.
think so.
Yeah,
Sure,
yeah,
sure.
very nice. Well done.
Yeah, very good, very good.
That was an interesting how there really was a nice synergy of
I'm very glad that you were able to talk about the
what
Paris
the three of you
Declaration
brought.
because I
Yeah.
didn't have time to talk about it. So I'm very happy that we were able to talk about that. Yeah. It's so important to put the principles of the Paris Declaration to work.
You did. It's very substantive. You were each very substantive. So that was excellent. Yeah. All right. Well, should we move around a bit? Okay. Yeah. So I'm thinking we'll give them 15, which would get them
Give them until,
about 25 till kind of thing.
yeah, that's right.
Yeah. But then we're gonna have a little more time for them to, and then a little more time for you to. Okay. Okay. Good. All right.
All right, you go that way, I'll go this way, and you go that way.
So I think we're going to circulate.
there'll be a bookshelf there. Excellent. I think I'll hold them up too. Okay. Okay, we're gonna. Testing. All right, thank you, Ellen. We're gonna go ahead and do a bit of a report out, and two or three comments. First of all, I want everybody to know that there's a tremendous set of resources. Yes, if our panelists can come back up, because we're going to see if we get some little.
I'd like to say a little thing later on if there's time.
Absolutely, good. Well, let me just a couple of things. One is we have some terrific resources for all of you, and they are going to be posted on the SID working group bookshelf. So on the SID website, there'll be the working group, and then there'll be a bookshelf. And there's some fabulous documents that our panelists have referenced, and others, and probably the notes from today. So I think part of this is an invitation that you really need to keep this conversation going. You know, so hopefully this is a punctuation mark today. You've already been talking about it, but that you'll continue, because as implementers, this is really vital if we're going to see the success of the SDGs. The second thing I wanted to reference is that when you report out, we'll kind of do some rapid fires here. You might just paraphrase the question, right? So you don't have to read the whole question. And then if you had any sort of really insightful thoughts about how you define the question, because I think that's been interesting, is that many of you defined it differently, and or raised the question of how could this be interpreted in probably a variety of ways, right? So maybe just any insights, keep that short. And then what did you learn that you want to make sure other stakeholders know about? Whether those are recipients or donors or implementers, what do you want to make sure, or policymakers, that we don't lose? Okay? So before we do that, I just thought I'd turn to the panelists and see if they had any quick insights that came to them about the questions, about the learnings, and or just about the table discussions. But you don't preempt anybody. But Elvira?
I believe that when we are talking about the donor-recipient paradigm, we have to look at how we work in global health. And we have projects, and sometimes these projects are supposed to deliver something, and then we are all disappointed when that deliverable doesn't last after 2 or 3 years. So I think we have to see projects as part of the country's overall program. So if we're doing a project on child health, look at the country's program in child health, the child health program. There's usually somebody in charge of that. How is your project helping that country program work better? And how is that then integrated as part of the system? Do the nurses' job descriptions have changed? Has the nursing training curriculum changed because of what you learn is now the new way of treating children or diagnosing malaria or whatever? So those things somehow need to be part of the system. So even when the project ends, things keep going without you.
Make sure the project's part of the continuum. Clive, quick comment?
Yeah, I think I'll go back to the value of integration. We always talk about how siloed the health sector has been, and we've seen how beneficial it could benefit from getting integrated into other sectors. And integrated programs have really shown the value of that. And for a long time, the siloed nature of international development, where maybe a certain funding only goes to disease X and not even to a vaccine Y, should be part of, the new paradigm should really be looking at integration, whether it's family planning with HIV/AIDS, whether it's with the environment, and getting people to work across the aisle will be an important part of the new paradigm.
Excellent. Diana, quick comment. We're going to come back to you.
I heard people bring up two separate things that I think are interesting for the whole group. One is that, well, how do you get donors to change? So there's an important role in this for donors and in the new paradigm and changes that they have to undertake, and are they willing and able to do so? And what role do the rest of us have in terms of actually facilitating that change? And the second one, frankly, is a very pragmatic one that's looking at that some of these changes cost. If we're talking about increased measurement, for example, there's a cost to that. And so, where does that come from and who bears that cost? And linked with that is a role for what is the paradigm look like for implementing partners if, in fact, in some cases, more and more responsibility and funding will go directly to local organizations or governments. What does that really mean? So those are three themes I heard that I think are important for the group.
Excellent. All right, let's go to the group. I think we'll start with this back table over here, because I heard them have a very interesting discussion.
Can we give them the microphone?
Just so everybody can hear you pretty well. Slides. That'll work? Okay, just loud so we can hear you.
So the question was, how will adapting the paradigm, and by that we understand that we should say how we changing from MDGs to SDGs, so that actors are held mutually accountable. How will that increase our chances of making good investments and ensuring healthy lives? So we focused on the accountability side of that, and the contribution I'm going to repeat is that we felt that the SDGs needed to be relevant and understandable down at a citizenry or patient level. X percentage of a million doesn't mean anything to a mother when she takes her child to be vaccinated. If the vaccine's there, that means something. That's right. So make those goals and how you measure those goals accountable to that mother, to the patient. They can then hold their community accountable, and in turn that community can hold the government accountable. Then we had a dichotomy between what the two governments, the recipient and the donor government, will do about accountability. And I'm now going to hand the non-microphone over to my left.
My goodness. Okay, so what we said was that there's a fundamental tension that donors are accountable to their taxpayers, and governments are accountable to their citizens. And sometimes those two don't meet very conveniently in a shared interest. And so when we really are looking at accountability, we had a discussion about whether or not moving from more specific MDGs to maybe less specific, more comprehensive SDG was good or bad, and whether or not that would help the accountability. In some ways, it could potentially, having a broader definition, could give governments who are serving their citizens more flexibility to define their priorities. However, it may also result in countries being less accountable to their citizens and instead just focusing on one particular area as opposed to the three specific goals that are identified in the MDGs. So we thought that accountability is really a loaded word, and it depends on who is holding whom accountable.
Very good. And make sure that you keep engaged in the accountability measures.
Discussion, yeah.
Very important theme that this table came up. How about this table right here in that?
So our question was, how should traditional donor-recipient paradigm adapt so that actors are held mutually accountable to achieving global national health goals?
So you had that accountability for two, but yours is the donor and recipient, right?
Yes.
Okay.
So there was substantial discussion over the first point, that being stakeholders need to be more involved in the design. I think people said things like, in the beginning, who actually designs the project, not the stakeholders and the recipients. Next, there was some discussion over the appropriateness of the lifespan of the project, whether it was short enough or long enough to achieve results and really be effective in achieving results.
there was also a discussion around multilateral relationships and how currently, when you talk about donor-recipient, it's almost a bilateral, and there needs to be more actors involved, specifically the stakeholders. There was also talk about needing to align with a national country's strategy. There was also a discussion around how funding isn't predictable, and having a more transparent process would lead to more effective results. And that's it.
That's excellent. Stakeholder, both design and engagement, really.
The main point.
Yeah, very interesting. Okay, let's get another table or two. So how about this front table? Because you had a wild card, right? Okay. Give it to us. Is it still leadership, or did it evolve? Now, where'd it go?
It evolved quite a bit.
Okay.
It was just kind of, we talked about leadership, and that's a really big question. We talked about, was it leadership around the development of the SDGs to decide on what the indicators should be at that level? So country ownership and leadership doesn't start there. Or once the SDGs are presented, then how do you help the countries lead from that point? And so we talked a lot about the roles. Is it donor leadership, country leadership, local organization leadership? So each plays a different part in leadership, and it becomes a really complicated situation. We talked about, we talked a lot about sort of financing and, how do you achieve results in the sense of, if a project has set indicators with funding and it all rolls up into different siloed projects, then who's actually leading that? Is it the country's responsibility? Is it some global entity tracking SDGs? So it becomes, again, about accountability and leadership, so.
Very interesting question, because I don't think the SDGs have defined leadership levels.
Exactly. That was our point, is that really who is the leader of SDGs and who is the leader at the country level, and then how does it become, if we're really talking about a big paradigm shift, maybe it shouldn't be the donors leading it, it should actually be the local government and the local organizations, but then who's funding it, who's presenting the right tools, so it becomes, maybe the shift is who the leader should be going forward.
And definitions of what they're leading about.
Right.
Yeah, very interesting. Okay, let's get another table. How about, we've got just a few more minutes. Let's do a couple of rapid fires. So, table in the back, give us your best shot, and then let's see if we can add these two tables in the front.
Okay, our question was, how does the paradigm need to change to ensure sustainable results and SDG 4 is achieved? And we talked around basically 4 items. The first is we need to have a sense of urgency and transition from parallel systems to local systems, specifically looking at shifting from more of a humanitarian model, maybe in a lot of service delivery, to actual integrating into the local country systems. We need to balance short-term acute needs with long-term sustainability. That has to both happen in conjunction with each other. We have to evaluate and measure for the long term as well as for the short term, and really focus on utilizing evidence in those, not just measuring outputs, but also measuring impact. And then the last thing that we said was integration with other sectors is important for sustainability. Examples: water, nutrition, agriculture obviously affect health. And so we have to see that integration in programming.
Don't see many programs or donors able to make a 10, 15-year commitment, right? So you have an immediate disconnect. Okay, how about one of these two tables? And did you have a question we haven't answered yet? Do you think? You had leadership? Okay. Any additional comments, thoughts?
Yeah, we do.
Okay, good.
I'm going to start backwards since everyone has talked about what we talked about, which was accountability. And our central theme on that was, how do you hold different actors accountable at different levels? And most importantly, how do beneficiaries hold local leadership of health systems accountable? So we thought about HMIS systems, because data have a power of their own, and they do get used or looked at. If they're not used, that gets noticed. Then we also heard about a wonderful example of how on one project, clinics were held accountable because boards were created, and then local civil society organizations played an oversight role. And then we started talking about the real driver that needs to be paid attention to, and we were breaking our brain over this, which is youth. The youth bubble in every country all over the world is going to have a profound effect on how these targets are actually implemented and how to engage them in a very fundamental way, in a way that doesn't frustrate them but engages them, is where we left off when we had our 30-minute or 30-second warning. So, thank you.
That's fantastic. There's not a lot about the demographics in the SDGs, are there? Okay, give us a quick highlight or two. What'd you find?
Well, we talked about most of the things people have talked about. One was, of course, that things have to be cross-sectoral. But what we thought was that it has to be bottoms up, meaning normally what happens in donor is that the donor kind of talks to the country head, and you don't know what's happening at the local and community level. So what we thought is, one of our persons said there are some working models that at each level you would engage the stakeholders at each level, get their input, and then you can hold them accountable, mutually accountable to each other. If the money is not there, they'll say, okay, you promised this. If they don't get the goals, you could sort of say, but if you start from the top, then you don't know if what you gave them is going to trickle down or not.
Co-designed by all the sectors together.
Yeah, and then make it multi-sectoral. Of course, you can't do health without clean water and environment.
Of course. Yeah.
Excellent. Okay, I got a hand up. Now we're going to just, if you really have a key comment from one of your tables, ones we haven't heard, or anyone else.
It's really fast. And
Good.
It's
We'll
going
do a little
off of
rapid
what-
fire here.
What she was saying, just the need for baseline measurement in these communities at the, national, local, regional levels to understand what the true need is. And then that should feed the design of programming across all sectors, I believe.
Good point. Anything over on this side?
I just wanted to know if any tables, in responding to what Clive said, came up with consequences that would hold people accountable but not hurt beneficiaries, because I cannot think of any.
Tough one.
I have this thought, everywhere in the world where deaths have, the death rate has lowered, what has happened is that the population has exploded because the birth rate lowering does not follow directly, and there's a bubble now. In a resource challenge thing, from what I have learned, there's not a lot of focus on reproductive and birth control. So if you have a population explosion in a resource challenge environment, what will you go back to is failing all over again. So this is something I need to understand.
Excellent. And the SDG does do a little bit more attention to this, doesn't it? Okay. Any other final comment? All right. We are going to turn to Diana to bring us home. What kind of summary thoughts do you have for us, or calls to action?
I can't talk with you about your question.
If you want to answer that first?
Yeah,
Your question?
sure,
Go ahead.
sure.
No, I'll
Your
just-
question about consequences, I think the key word that I like about the new SDGs is sustainable. So everything that we do has to be sustainable. We have to have a way of sustaining it. Some structure, some institution in the country has to be responsible for that. And if you are not able to do that, then the consequence should be that your project should be terminated. There should be no tolerance for poor performance. We need to really be very professional and find the solutions to the problems, and not just, we'll win the next one. We'll win the next one.
I agree.
Yeah.
But I don't want to let you cut off the maternal and child health program. Those tough choices where it's, okay, in a case of Uganda, people are upset. Well, let's cut off the funding for, no one's going to, there's political issues, there's
You're not going
health
to cut
continuity
the funding.
issues, so how does that work?
Yeah, no, you're not going to cut the funding and penalize the patients. But you have to make sure that you have an alternative plan to not wait until the last minute when you see the project didn't deliver, that to say, oh, this didn't work. I think you have to be very good at really monitoring the results. And the most important thing is, I think, understand that you need health facilities to deliver health services. And most of the time, just training people doesn't mean that you're going to really make all the other changes. And for instance, the toilets in the health facilities need to be cleaned. And with that,
Yeah.
things don't work.
So big questions on
Good.
penalties, right? Okay.
Yeah, I think
Diana.
I'll start with that, and then I'll just try to quickly summarize a lot of really good input from everyone. It's great to hear your reporting out and to have a few minutes to sit with many of you at your tables. So I think the consequences is a major issue, but we all are aware that Global Fund does stop funding countries. So I think part of it is being very upfront in what the expectations are, but also then having some change in terms of, it could be the amount of money, it can be the duration of it, it can be putting in things, I mean, these things haven't necessarily been tried, but there could be having an accountable organization that's embedded in whatever the recipient organization is to ensure that things are addressed. So I think there are ways to have recipients, whatever, be they government or implementing partners, be held accountable. But the transparency up front of sort of what the expectations are and what in fact will be the result if they're not, and then clearly having alternatives that will not, you know, close the clinics, stop the community-based programs, so we are ensuring that beneficiaries, it's actually me that said the beneficiaries are not hurt, okay? So I think that's a really important discussion, and frankly, I'm not sure that there's been enough attention to that internationally or around SDGs. So I have the delight of trying to summarize in a few words many of the things we heard today. I'm going to start out with the importance of the urgency, all right? I think Elvira was very passionate, and appropriately so, that it is absolutely almost immoral that we have mothers and children dying today when we've had the interventions to prevent illness and death for so many decades. So the urgency for all of us, all stakeholders, to be aligned and move now is really important. It's really critical that we're honest with each other, again, across donors, recipients, regardless of the type, and that we learn from our successes and our failures or our errors, and to really hold ourselves individually and organizationally accountable for learning. And perhaps we need some more channels to promote that learning outside of the silos. Another important thing is that we have to break the silos between governments, partners, and donors. We tend to see horizontal communication. We're saying look at cross those silos, have combined input into design and implementation that includes not only the donor but the recipients, and that those programs or projects have to be aligned at the country level to in fact meet country priorities and be consistent with their plans. We talked and heard, particularly from Clive, I think very important information about ownership and what does that really mean, and specifically putting the community at the center of that ownership, sort of flipping it. You know, often we're up at the high level on many of the accords, Paris and so forth, Accra, Husna, our high level. We need to really flip it and be at the community level to understand what true ownership is, and the role of the civil society and individual citizens in that, and their role in decision-making as well. The role of the local government and its importance, not only against state or Ministry of Health, but the local government really has to be front and center if we together are going to meet the SDGs. We talked also about the importance of trust and accountability, and you did as well. Trust between donors, trust between recipients and governments, implementing partners. And that trust is that foundation for the transparency and for the collaboration, really, both in terms of design and implementation. From across the tables, there was a lot of really very good points that you brought up, and I'm just going to bring up a few of them that I think are particularly relevant for us to take home. So the table that talked about accountability, I thought was very prescient in talking about making sure that whether we're talking about results or indicators, that they're relevant and understandable at the household level to the ultimate beneficiary, to the mothers and the children and the fathers and the families. And that's absolutely fundamental for us to go forward and really mobilize communities, mobilize us all to reach the goals. We heard also that clearly not only recipients, but in terms of government, but also civil society and implementing partners have to be more involved in the design, and that the accountability will come and the ownership will come in part when they are more involved with the design of the projects and or the programs. We heard, I think, a very important point. When you look at the countries that have been successful in reaching at least 1 or 2, MDG 4 or 5 in particular, one of the things that comes to the fore is leadership. And I think that was something that was just touched on, but is very important. And building leadership across the levels of the delivery system or the levels of health care, but also in the government and also even in donors. One of the tables said, but really who? You all said, well, who's leading really the SDG? Who's really got the leadership and where's that coming from? And in fact, we realized it hasn't been that well defined. It's defined, again, high up in the altitude, but what does it really mean when you take it down to local government and citizenry. We talked also about the importance of results for sustainability, but I thought one of the most important statements was the relevance and the need to work across sectors. So one of the challenges with the MDGs, in fact, is that everybody worked on each MDG, and we never kind of really worked across MDGs. SDGs are broader. There's a challenge in that, as someone said. Is that going to give more flexibility, but also less accountability? But there also can be some real power in that, and even working across SDGs will be important. And lastly, I thought there were 2 very interesting points. The youth bubble. Really, none of us can ignore the demographics and the reality of burgeoning youth globally and how important they are for us all to reach both MDGs and SDGs. There's no way that we're going to reach them unless the youth are involved, engaged, part of the solution, and frankly, if the poor are not reached as well. So I would say the youth is really important, and also the poor, and we need to make sure that lowest quintile is equally met, and those that are in the countries that have been lagging the furthest behind. And I'll finish up with saying I think the importance of stakeholders co-design at every single level across recipients and donors are a critical part of that new paradigm.
Thank you, Diana. You did a terrific job on that. Not easy to do. And I'd like to close by, first of all, a few thanks. So I want to thank SID for the day and for making sure the SDGs get attention. I want to thank our 2 working group co-chairs and all their leadership to start the conversation and to help continue it. And I want to thank our panelists who've done a fantastic job, both queuing us up, but also helping to engage with the audience. And I want to thank all of you. And last but not least, we really want to make sure that we get your cards. So don't leave without giving them to us. For those of you that have written out on them, that'll help give us more evidence of some of the conversations you had. And finally, I think that what I'd like to close with is just a compelling thought that has really been on my mind in the last hour and a half as I hear all of you and your input. And that is, what an amazing time we live in that we could actually think about these goals and this SDG being achieved in our lifetime. And I know many of you have been in the trenches for a long time, and you used to think about a project or 2, right? Yeah. And now in global health, you think about a country or 2. And what if we now really think about these global goals and that they can happen so that our own children can move on to the next set of issues, right? So really powerful stuff. And I think getting it right and getting the urgency right and the framework right is all of our really work ahead. So I encourage you to make sure you're part of the conversation and make sure that you're part of the stakeholder process with SID, Global Health Council, and others as we move forward into the real work. So thank you again for all of your tremendous efforts.
Let's get it done.
Exactly.